I'm delighted to share with you details of our collaborative intervention for deprescribing, which was a pilot study. Deprescribing is the planned, supervised process of dose reduction or stopping medications that may cause harm or no longer be of benefit. Pharmacists may play a role in leading deprescribing in primary care. The purpose of our pilot study was to develop, implement, and evaluate an intervention for pharmacist-led deprescribing in collaborative primary health care settings. We carried out our pilot study in 3 primary care clinics in Atlantic Canada. There were 2 in Nova Scotia and 1 in New Brunswick. The pharmacist-led deprescribing framework was developed with intense patient and other stakeholder input at a 2-day stakeholder forum. The framework targeted 8 drug classes, but was flexible to accommodate any medication. Patient and practice site engagement tailored the intervention to local context. Healthcare professionals were surveyed pre and post intervention for attitudes toward the intervention, and patients were surveyed pre and post intervention for their experience with pharmacist-led deprescribing and to collect demographic details, medical history, quality of life, and measures of medication use. The analysis included descriptive statistics and assessment of written responses. Due to COVID-19, we were only able to enroll 13 patient participants. Half were women, and the mean age was 72.5 years. 11 of the participants reported comfort with pharmacist involvement prior to the intervention. Patients took an average of 9.3 medications at study entry and 9 medications at exit. Zopiclone was the most common target for deprescribing. All 5 participants who responded to the follow-up survey were positive about the experience. Healthcare professionals were positive about the intervention before and after the study. However, there was limited healthcare provider response after the study. This was due to challenges with consenting processes as well as COVID-19. Overall, the pharmacist-led deprescribing intervention was acceptable to patients and healthcare providers. Patients reduced use of medication deemed to confer more risk than benefit. Future work needs to assess larger scale implementation and evaluation of pharmacist-led deprescribing.